how to get rid of that belly, that hanging belly without a tummy tuck. We have no BMI restrictions. We do large volume liposuction. If you're ready to change your life forever, the next step is getting your quick quote. Quick quote is an easy way that anybody can get a basic quote for our most common procedures. You simply go to our website, myshapelipo.com. You click on the link there for the quick quote. You're going to enter your height and weight and your name. And that's it. That's all you need to get your quote, and have some basic questions, make some selections based off of the options that we have, and you can get your quote quick and easy, no pictures required. Now, if you're serious and you're ready to move forward and you want to get something done, the next step is getting a formal consultation. So you're going to want to do that so we can actually take a look at your pictures and make sure that everything's on par with what we're doing. We can create a plan for you.
Liz dice, hola señora, estamos acá contestando todas sus preguntas de liposuction y transferencia a la grasa a los nalgas y senos. Bueno, si tienes algunas preguntas, eso es una oportunidad que nosotros damos a todos a preguntar cuáles son los secretos de liposuction. Estamos haciendo eso ahorita, entonces háganos algunas preguntas.
What's up, Rebecca? Rebecca. I hope you had a good trip in Florida. Maybe you're still there.
Rebecca, what are you traveling by yourself for?
Get the hell away from things.
Yeah, I know, but it's always funner to travel with somebody. Your husband doesn't want to go?
She's not married.
Oh, I mean...
Boyfriend. Andres.
Sorry about that.
Her boyfriend has the same name as my middle name.
Oh.
So that's why I remember.
And that's why you guys are soulmates.
Yeah, soulmates. I don't know about that.
Connected.
Yeah. Looks like someone from the office is online here answering questions for you as well. So if you guys have any questions, we're taking questions here. We'll answer them the best that we can throughout this hour. And if any of our questions, your questions go unanswered, there's a lot of, I just added a frequently asked questions section to the quick quote. So hopefully a lot of those questions that you have, you can answer just by going through the quick quote system. There's also a bevy of videos in there explaining a lot of different things, many of the things that we discuss here in the live situation, but those videos are all available on the quick quote to answer your questions. And the quick quote, again, is just to give you a basic idea and educate you and get you a quote so you know what it's going to cost you. And maybe you're ready now, maybe you're ready in the future, but it's at least you know. What's up, Beatrice? Erica? Rebecca says she's home now. She says, not more fun to travel with other people. I agree. I prefer traveling by myself.
I mean, it depends on where you're going and what you're doing. I have trips that I take by myself.
Oh my God, it's so much better.
Awesome. I have trips that I just take with my wife. Awesome. Mm-hmm. And then I have trips where I take it with the family, and those are awesome too. So I enjoy the entire spectrum.
I think that going by yourself, it gives you that opportunity to actually think. When you're around other people, you're engaged in conversation, and you don't have time to actually think about yourself and your future. And so I think going on your own is actually necessary.
Mm-hmm. Totally agree.
See, Anna.
So Lizzie asks, ella dice, me gustaría hacer mis brazos. Bueno, es bien fácil. Eso es una cirugía donde podemos sacar la grasa de los brazos y bajar el tamaño. Muchas personas han recibido una cirugía en los brazos. Solo tienes que ir a nuestra página de web para fijar algunas preguntas para sacar un precio bien breve, y cuando estés listo, fija una consulta formal con nosotros y podemos hablar contigo en cuanto a cuáles son los metas que tienes. So she's saying, I'd love to do my arms, and we can do that. We do that all the time. We just go to the website and fill out the information. You'll get a pretty quick price, and then when you're ready, schedule a consultation. We'll talk to you about your goals.
So Anna says, ¿Cómo ser elegida para lipo? What does that mean first?
¿Cómo ser elegida para lipo? Well, so Anna, I think what you're asking is, how are you selected for lipo?
Is that like eligible?
Yeah, it's
okay.
to choose.
Okay.
¿Cómo ser? Anyway, bueno, casi todas las personas pueden tener ese proceso, esta cirugía. No hay muchos requisitos, solo tienes que hablar con nosotros, entregarnos un poco de información y cuando estés listo, fija una consulta con nosotros y podemos hablar contigo en cuanto en cómo es sus metas. Sorry, that was a little butchered.
Rebecca says she loves solo trips to get more and more to do. She doesn't drink or party, but ends up meeting people on her adventures. That's cool. You know, Corinne's my wife's brother. He would travel a lot and go like all around the world, and he would actually go with traveling groups. So you meet new people and you get to do different stuff.
That's pretty cool.
I think it's
Probably
a
a lot of like-minded individuals, and so it'd be easy to relate.
Yes, she said very zen meditation. Awesome.
So Kathy says, do you do fat transfer to the butt area? Absolutely. We do it to the butt area and the breast. Those are the two most common areas. You can also do it to the face and some of the other areas of the body, but yeah, the most popular is the butt and the breasts.
Myra says, ¿Qué precio tiene una lipo papada?
Myra, she's asking what's the price for the chin.
Okay, ¿es papada?
Esa es la papada. Mayormente estamos por 2,500. Pero tenemos que ver lo que tienes abajo de acá para que estamos de acuerdo y el tamaño está algo que podemos hacer y si es correcto para su tipo de cuerpo. Hay muchos factores en eso, ¿no?
So, ¿cuánto tiempo es la recuperación de la lipo? So, with the recuperation, I know this answer is in our quick quote. So, if you go to the quick quote, in our frequently asked questions, there's a question there about the recuperation.
And if you guys ever want to learn Spanish, you just have to grow some hair out like Trevor, because he's doing an amazing job.
Yeah.
Bueno, el tiempo para recuperación depende de cada cuerpo, de cada persona. Muchas personas se pueden regresar al trabajo en algunos entre 4 o 5 días, algo así. Algunas personas ya han regresado a su trabajo en un día, pero depende de su cuerpo. Pero mayormente todos son entre 3 o 5 días.
Carol says, how do I get a quote? That's really easy, Carol. You're going to go to our website, myshapelipo.com, and right on the front page, there's a link for the quick quote. And you just click the quick quote. You're going to go through the process, and it's just based off of your height and weight and a few selections of various areas that you want to treat. And this gives you a basic idea of our pricing. And then if you're serious beyond that point and you want to move forward with the procedure, the next step is a formal consultation, in which case we actually speak with you. You speak with myself or Kale. We need to review pictures of you, review your medical history, make sure that you're a good candidate for the procedure, and we'll verify the quote that was given in quick quote to make sure that it was accurate. ¿Cuánto por lipo?
Eso depende de la parte del cuerpo que vamos a tratar, el tamaño. Hay muchos factores. Tienes que entregar se puede entregar un poco de información y sacar un precio básico en cuanto a lo que cuesta cada área, pero si estás lista y quieres saber con seguridad, tienes que fijar una consulta con nosotros para que podamos hablar contigo, ¿ok?
What's up, Omel? It's the guy I went to school with in New York.
Dude, he's always online, bro.
Omel, he doesn't work. You know, the funny thing is,
do you practice medicine, or are you just chilling on the web all day? I like it.
And everything he posts is about beer. He's a beer lover.
Oh, man. So, Mel, do you have one of those bellies that we need to work on?
I've already worked on them.
Oh, yeah? Attaboy.
It was a while ago, though. Okay, so Ruth says, is the picture in the background from one session, or do you need more sessions? So we never do multiple sessions on the same area, if that's what you mean. Most of our patients will come back and get multiple parts of their body. As you can see, we treat larger individuals, so those larger individuals may need more than just their abdomen. So many of our patients come back for 3 or 4 procedures to end up getting full body liposuction because they're happy with the results. But to answer, if you were wondering, because I know that there's other doctors that actually plan to do multiple procedures on the same area as if they can't get enough out in the first procedure, and we do not do that. We get as much as out as we can the first procedure, so you never have to go back into that same area again.
Yeah, Marisol Las Vegas, or Marisol Vega, 825 price. Yeah, you just have to go to the website and click in your information. And there's a very easy way to come up with a ballpark price according to what your body style is and the areas that we're treating. And then when you're ready, you set a formal consultation. We'll talk to you about your goals, and then we'll get you a formal price with photos and everything, okay?
Okay, so Nancy says, how long do you have to be in the recovery house? So the deal with our recovery house, so if you've done the quick quote, you'll see we have the option for you to stay at a recovery house. It's an additional $1,250. And the deal is what you stay in. And again, there's also an answer within our frequently asked questions for this question. So the deal for that is you get to stay at the recovery house for 3 nights and 4 days. So ideally you're going to come in the day before the procedure, you check in, you stay that night, and you get to the procedure the following day, and you stay for 2 nights following that. The nice thing about this recovery house is it's inclusive in that you get included with the price. You get transportation to and from our office, to and from the airport. You get meals, you get an additional garment, and you also get therapy, so lymphatic massages. So it's a great deal. It's definitely worth it.
Yep. And the girl that runs the surgical place is very, passionate about lipo procedures, and she does this a lot, and so she's very knowledgeable, and she's just super excited to help out. So.
And that's Lexi. If you're on the support group, the Mind Shape Lipo support group on Facebook, Lexi's there a lot, so you can communicate with her. Okay, Rebecca's offering up her before and after photos. I think she likes showing off.
She does, which is good. Which is good.
Yeah, she looks great. Okay. Is it Juliana? She says, I'm interested in an appointment. Are you guys located in Vegas? Yes, we're in Vegas. And the first step, if you're just getting on this channel, is that you can go check the quick quote. And the quick quote has a ton of information through videos as well as our frequently asked questions, but you'll also be able to get your price, your quote, for based on what you want. And we have generic type packages there, so it's what most people are getting. However, obviously it's not going to cover everybody, so you can get an idea of what the pricing is, and if you like the pricing and you like what you see, then the next step is scheduling your formal consultation if you're serious.
So here's Rebecca again. This is her starting point, and
Marie says she has no cut from tummy tuck. Absolutely. And Marie, you'll see none of our patients, not a single one of them has a tummy tuck, at least from us. We have many patients that get tummy tucks prior to coming to us because they're boxy in shape. In fact, I just had another one, a consultation yesterday, where the individual, she had a tummy tuck about 8 months ago, and now she's looking to get liposuction because she was left like a box. Like, you guys have heard me call people SpongeBob SquarePants. She was shaped like a box because the tummy tuck, it took the front belly off, the fold off, but it left her wide on the sides, wide in the lower back, and she had no shape to her butt. So liposuction can definitely help if you've had tummy tucks in the past.
Yeah, and if you don't believe us, just jump on our Facebook group. The support group is a private, semi-private group where a lot of the girls post their before and after and their progression pictures. So you can absolutely confirm that we do not do any cutting at all. That's an interesting thought, that most people jump on this thing and they're thinking, oh, everyone's told me that I need to get a tummy tuck. Listen, in very rare few occasions do you actually need to get a tummy tuck. The skin responds very well, and try the liposuction first, and if those results are not what you're looking for, you can always get a tummy tuck after that. But I'm telling you, the results that we're getting without doing tummy tucks is pretty profound.
It's incredible. Omel's defending himself. He works 6 to 6. And to be fair, he's in New York, so he's 3 hours ahead. So right now it's after his work, and it's always after his work. So we're just joking with you, Omel.
I was just giving him a hard time. Okay, so this question is from Letty Ramy. Hi, what is the difference between tummy tuck then lipo? Okay, so With tummy tucks, they do a little bit of liposuction. Liposuction is the sucking of fat or liposculpture. Tummy tuck is where they cut you and they pull your skin tight, and that creates the illusion that there's not as much fat there. They do a little bit of liposuction with the tummy tuck, but not as aggressive as what we do. So we get a lot of patients that have had tummy tucks that didn't get a whole lot of fat taken out, and they come to us to get the fat taken out.
And you can see this from this picture behind me. This is a man here, so this is not just for women. So you have husbands that have bellies, or boyfriends, or you know somebody that has a belly that they want to get rid of. This is definitely going to help anybody. You know, fat has no sex.
So this is so Sarah brings up a good point. Tax season, ladies, get your body done before the summer. Absolutely. Now, if you want to go have a great summer, a summer like you haven't had in years, absolutely. Now's the time to do it. You come in, get treatment. By the time the summer rolls around, you're ready to go. And I promise you, your interactions, your social interactions, your excitement about going to the places where there's a lot of water, like the beach and the pool, will absolutely go up, and it'll be a completely different year for you, I promise.
Marie, I'm sorry we're delayed, and these pictures behind me keep cycling, so I'm not sure which picture that you spoke of. However, these are single treatments. We don't do multiple treatments to the same area. So like this behind us here, this picture, this girl had one procedure, and that made her that size. So that belly goes away with a single procedure, and that's the way we do it on everybody. The larger individuals, you can't do the 360, but on larger individuals, we focus our efforts on the front of the stomach. So this is only the front of the belly right here, but you can see how big of a dramatic change it makes. And I really like, personally, my biggest change with the abdomen is that the breasts stick out further than the belly. I think that's a huge proportional issue that many people have, and if you have that issue, it really sucks because your breasts they get hidden essentially by your belly.
Yeah, and I'm super excited to see how this one turns out and watch her progression, because as I was working on her and I had a conversation with her, I kind of I try and create, try and figure out what the backstory is, what the why is, why people come in and get liposuction. And her story was, ever since she was a young girl, she was always on the heavier side. So she was always considered that chunkier person. So this is going to be new for her. This is new territory for her. She's, in her late 30s, maybe early 40s, I think. And, she looks amazing. She looks amazing even after a couple of months. And you'll have access to her, and you can talk to her directly through our Facebook support group. And you can pick her brain, and you can create a relationship with her. I'm sure she'll be open to go ahead and discuss her whole journey. It's pretty amazing.
So something I think that you guys should start thinking about, if you haven't had these procedures before, you're not familiar with it, is when you see these after pictures, just try to imagine what a person is capable of doing with the confidence of when you look better like that. How would you be different? What clothes would you wear differently? Would you feel more confident doing things, or, going out to the pool, or going on vacations, or going out to, social events? Like, what would you feel comfortable with? Because how many women are stuck in this body that they just feel uncomfortable? They're embarrassed and they don't want to go places, and you end up staying at home, and how much of your life do you miss? And that's the thing that I think that nobody really calculates in the cost of this, and what the value of this procedure is like, what are you missing out on your life, and what is the cost, the opportunity cost of losing the opportunities that you have because you're just embarrassed.
Yeah. So Pretty Girl asks, how many rounds would it take to get rid of multiple bra rolls? That's a tough one, right? Because we can't see what you look like, and so we can't gauge. But we've treated a lot of bra rolls with arms, and the results are pretty phenomenal. And so every case is unique and dynamic in its own right. So just submit your photos, or get on, do the quick quote, and then when you're ready, set a consultation with us, and then we'll talk about where your goals are, and we'll discuss getting to where you want to be.
So Ruby said, I guess referring to one of the pictures, did she have only lipo, or what did she have done? So all of the pictures, all we do is lipo. The only thing we do is lipo. There's none of these people are getting cutting procedures, nothing on their thighs or their arms. We're not cutting any of the skin away. You can see how well the skin retracts back. This happens with just liposuction. So We are uncovering the myth that plastic surgeons have spread out through our society, telling people that if you have any looseness of the skin or you're over a certain BMI that you have to get a tummy tuck. That's simply not true. You don't have to get a tummy tuck. There are alternatives, and the alternatives are pretty damn good. And the name of the support group is My Shape Lipo Support Group. It's on Facebook. You're going to simply go to Facebook, click on the groups, and search My Shape Lipo Support Group. It's got our logo on it so you can recognize it. That's right, Rebecca's results.
Cozy La Crate. Hi, how are you doing? She's on the YouTube channel. I'm glad you jumped in. We're talking some lipo, talking fat transfers. We're talking about what the body can be once you transform and what you can, aspire to be. That's what these photos are all about. They're all about motivation. They're all about showing you, how to live in a way that you shouldn't have any fear of your body. You get rid of all the misconceptions and the anxiety that you have. Come get treated, and then start a new life. Start something new.
It says it was Alice. I'm not sure what that says. Santiago. It says, do you need to be a certain weight? Clearly we do larger individuals, and we help larger people, higher BMI individuals. So the BMI is not used to restrict, but rather to categorize and price each of our patients. But you can see, we have patients that are 250, 300 pounds. But as you get larger, there are more potential risks. So, that's why people over a BMI of 45 is we want to talk to you, because there's a lot of, when you get to a higher BMI, the volume of your fat is displaced differently. So everybody, since you carry it differently, we have to be available to do different plans.
Mendoza Mary says, hola desde Chicago. She's checking in from Chicago. Gracias por venir, Mary. Estamos hablando de liposuction. Cozy La Crate says, I'm trying to get lipo this spring, and she asked, do you work in Jersey? No, we don't. We're in Las Vegas, Nevada.
How about Chicago? Do we go to Chicago?
We do not go to Chicago, just only to visit maybe from time to time.
That's where my family's from.
Yeah, but no, if you want liposuction from us, you got to come out to Las Vegas. It's very easy. Flights are cheap into Las Vegas. They want you to come out here and lose money. So come out here, schedule a nice little weekend. We'll do some liposuction on you. We'll change your life, and then you can go back and you can flaunt off to everybody else in Chicago or Jersey.
Says Ruby says, I saw your work. You performed on Tati. Y'all did great. That's awesome. We love Tati. She's amazing. Tati's already calling to. She wants to get her upper body treated. She wants to do her arms and her back and underarm area. So she'll be back soon.
Listen, here's what happens, right? You start looking good and people start taking notice. Then you want to start. Then you might get a little hypercritical of the other parts of your body. And Tati's one of those persons that's been blessed where she can do multiple procedures, and so financially she can, it works out for her. So she's here again. She's gonna come back again and get her 4th procedure. Dom says she can't wait. Dom is gonna come in like another month, and we're gonna treat her. And I can't wait to post some photos of Dom, because her transformation has been pretty amazing.
So Irma says, you have a question. You had 3 C-sections and a lot of stretch marks. Will lipo help out with the stretch marks not to be noticed? So I was looking at the back here. Most of our patients have stretch marks, and it's hard to see on these pictures, obviously, because of size and what we're dealing with here. But however, go check. First of all, check in with the group. Those girls may be able to show you better pictures of their individual situation. But if you think about this is how I describe the situation with the stretch marks. So the stretch marks are damage to the skin. So when you get bigger, you can imagine your skin stretches out, and so it stretches and it gets damaged. So the tissue that's holding the skin together, it gets damaged, and you'll have this it pulls apart, and you get linear stretch marks. So these stretch marks, as you're larger and you have more fullness, they're stretched and they're wide and they're thicker and they're more obvious. When you remove the volume of fat, so you can imagine you're all stretched out now, it looks big and thick and long and wide as far as the stretch mark, but when you remove that fat, everything contracts in and gets smaller. So now the damage to the skin has already been done, so we're not repairing the damage. However, what we're doing is we're taking the pressure off of the stretch mark, which alleviates some of that pressure, which shrinks it horizontally as well as vertically. So it makes them less obvious. It also seems to change the color of the stretch marks with less pressure on them. They tend to become more flesh color. Some of the larger ones can get irritated and have like a purplish reddish color. So again, it doesn't repair the damaged skin. However, it makes it less obvious visually. So
And there's some additional treatments that help after liposuction that can help tighten up the skin even further. We offer one of them, Venus Legacy machine, which works really good too.
in addition, during the procedures, we also use the Smart Lipo laser to further enhance the skin tightening. And again, the more tightening we can get of the skin, the less obvious these stretch marks will be. Ruth says the link on Facebook is not working. Facebook is, we're having problems with them. Actually, Facebook's itself is having some big problems. It's an issue with the privacy issues. So the link, that's why I put in the link. You can't just click on it. You have to copy and paste it and put it in a new toolbar or search bar. So please do that, or you can simply just go in a search bar and search myshapelipo.com. You'll get to our website, and the link is there. So I apologize for that. It's not our issue. It's Facebook. So we're trying to work within their issues.
Pretty Girl says, how many liters were removed from the girl in the red bathing suit? So listen, Pretty Girl, there is not a particular hard and fast rule as far as how much fat we take out. We take out what's appropriate for your body, okay? So we will make sure that we do this in a very healthy manner. We want to make sure that you have a good experience, and we want to make sure that your body is able to respond appropriately. So yeah, I don't know. I couldn't tell you. I can't even remember, but it was a lot.
Ruby says, thank you for responding. I've been told I need a tummy tuck, but I look similar to your before and afters. And I'm definitely going to you. So Ruby, I appreciate that. And that's really one of the biggest things that I talk like this. I go public and speak about on this, that you don't have to get a tummy tuck. And unfortunately, there's so many women that have told you have to get a tummy tuck that they don't even know there's an opportunity to not get a tummy tuck. They think they have to do it. So since you have realized that it is possible to do this without a tummy tuck, I'm sure that you have friends and family and there's many other women out there that need to be saved, because there's some women that we don't get to in time and they go get a tummy tuck and they still have a lot of fat left behind. As I was saying just about yesterday, I had a consultation. This young lady, 28 years old, had a tummy tuck out in the Chicago area about 8 months ago, and now she's left boxy and square because they simply didn't get enough fat out to sculpt her body. So I hope that we've influenced you, but I've also hoped that we can influence and save some other individuals so they don't make the mistake of getting a tummy tuck.
So Jessica says she really is tired of her stomach. Can we explain if these, I would assume these big stomachs are considered 4 areas or 2? So that was like the old system. When you jump on the quick quote, you're able to put in your BMI. It gives you a category that you typically fall under. You click into that category and it gives you options on how we approach most people in your particular BMI, given your particular area that you're concerned about. It works for most people. Sometimes it doesn't, but yeah, jump on there and do a quick quote. And that'll give you an idea on how we treat this and how we go about these liposuction procedures, especially for the larger, body habituses.
Yeah, so it's not the pricing is not off of areas anymore. It's based off the BMI, which is a representation of the volume of fat that we remove. So in higher BMIs, we have to remove more fat, and that's related in the pricing. Marie says, I've been here since Candy Lover '89. That's been a while. I think that was like 2017, 18. Do you remember, Granville?
17, yeah.
Yeah.
For me.
She came back for a couple procedures. So, is this multiple sections? Okay, Latonda. Again, we're not pricing based off of sections or areas. So using that terminology is not relevant with our pricing anymore. So again, just go get the quick quote. It'll answer all of your questions. Real easy. Just go to the website, myshapelipo.com.
There's Audra. What's up, Audra?
Hey.
Audra had some pretty amazing results, and her life has completely changed. And I think she's one of those ones like Rebecca who likes to travel a bunch too, and she's always out doing something.
Yeah.
Kaboom! Look at how sassy that one looks. She ain't even Christmas.
Raphael
Look at that
Marie
confidence.
says, do you look at your patient's medical history prior to getting lipo?
Absolutely, we do. Why? Because that's a very crucial part of you being considered a candidate for this particular procedure. There's a couple of disease states that, you know, if we don't feel comfortable with, we might get your specialist involved. There's a couple of them that we, you know, try and emphatically say no to, but most people are definitely a candidate for this particular type of procedure, especially controlled diabetics. Now, if you're poorly controlled and you know you've had diabetes and you haven't been taking your medicine and you're poorly controlled, you're going to have problems with wound healing and the whole recovery process. So we want to make sure that you're a controlled diabetic. Hypertension, you know, this can help with the hypertensive state of your body. Yeah, so overall, there's very few disease states that we exclude.
So Elsie says, do your consultation and book your procedure. Elsie was one of our previous patients. You've probably seen her picture up behind us. She was obviously super happy and an advocate of this procedure.
And she just posted on the group a couple of days ago.
Yeah.
She looks amazing.
Sarah says, how many days do I have to stay there before I can go home? And I'm from New Jersey.
So Sarah, we'd like everybody to show up and, you know, just kind of count for 4 days, right? So you show up the day before your procedure, kind of get the anxiety turned down, get settled in, you know, have your procedure the next day. We want you to follow up in our office for a lymphatic, you know, treatment the next day. We can make sure that everything's okay. And then after the 4th day, you can, you know, it's okay to go back home. But if you're here for a couple of days, we can, you know, and something happens, we can absolutely take care of you. It's a lot easier to take care of you here than it is when you're in another state.
Okay, so Ms. Vasquez says, can someone with diabetes and hypertension get tummy lipo? So as you can see, many of our patients are larger, and larger individuals have these problems. They're diabetic and they have hypertension. Many of them do. So, you know, I would even venture to say, you know, a larger percentage of our patients have these issues. However, the nice thing is that liposuction actually benefits these disease processes. So your hypertension can be reduced through liposuction. The diabetes, the medications, and what would you call the diabetic profile improves with liposuction. So many of our patients after the procedure have been able to reduce or get off their medications, which is an awesome thing. So in order to qualify to have the procedure, it's just a matter of being healthy. So you can have diabetes, it needs to be controlled. You can have hypertension, it just needs to be controlled.
So yeah, this is a very non-invasive procedure. We're basically creating access points in the skin. We're injecting medications into that fat layer, and then we're removing that fat layer. It's done in a very short time frame. We're able to get you bandaged up, get you back home, you know, resting to recover. And so it's not invasive at all. You know, we're not putting you under general anesthesia. We are basically just treating the fat areas directly, and you know, a lot of people have benefited from this particular procedure.
Okay, so Irma says, can I get my stomach, lower back, and arms done in the same day? So typically no, but we're gonna have to see pictures of you to verify this, but typically no, and the reasoning is that our limitations are the amount of fat that we can remove on the individual, as well as the amount of numbing fluid that we could use to remove that fat. So there becomes a point where if we push the limits too far, it starts to increase the risk factors to the patient. So our primary goal is to keep you healthy without any problems after the procedure. So if we need to create these procedures the proper size in which that we are not going to far exceed the limits. So again, Irma, go for the consultation. This seems like something that you'd want to do, the paid consultation, so you can speak with myself or Kale, so we can review your specific situation and make a determination, and also explain to you exactly why we want to do the treatment plan for your body.
So, and please, another thought is, don't try and argue with us over the phone about it. We've had that in the past a couple of times. Listen, what we want is we want the best experience for you. We want to give your body the best opportunity to succeed. And, by pushing the limits, which, we already think that we feel that we get very aggressive in our approach a lot more than everybody else. And so, listen, we do it with reason, we do it with purpose, and we do it with care and considering all of the medical risks that are there. So, please don't call up and say, oh yeah, well, I can do my belly and I want you to do my arms. Don't do that. It's just, we're your medical providers. We're going to try and take care of you the best we can. Okay.
Tori says, I'm 5'3", 155 pounds. Do I qualify? Of course you
Qualify
do.
for what?
Of
Yeah,
course.
listen.
Go to the quick quote. You can get your price right now, Tori, and then then you can schedule your paid consultation. We get you scheduled up within a couple weeks or a month.
Sandy Valley 21 sent a request to jump in the live video. Sorry, we can't do that, Sandy. But I think Sandy Valley just right out here, right outside of Vegas.
Yeah, Sandy Valley.
Mm-hmm.
Okay, Marie Vasquez says, what is the pain level during procedure since it's not general anesthesia? This is a good thing. I could tell you whatever I want to tell you, to be honest with you, but this is a good thing to go speak with the girls from the group. There's a wide range of responses to this procedure. There's some people that are like laughing throughout the procedure, and you can go see some of our live procedures. We just did a live procedure with Tati. That should be hosted on our Facebook page. And you can see the way that she's reacting. So some people do extremely well, and other people, it's a struggle for them. A lot of this has to do with how you tolerate things in general. I just went to the dentist the other day, and I'll tell you, I didn't feel much of anything, but it was so freaking uncomfortable. It was like that like grinding in your head, and it's like the whole process was, I didn't like it, but it didn't hurt. So I would imagine that there's probably a component of that to the liposuction where it doesn't necessarily hurt. However, it's weird as hell, and some people don't tolerate that stuff.
See, and I'm on the other end of the spectrum. When I go to the dentist, there's no amount of numbing medication can actually get the areas numb. And so, like, he works on me, and it just feels like there's no sedation at all in that area, no anesthesia in that area. So I just have to kind of just grind through it, and I know it hurts, it's painful, it's uncomfortable, but I know that I need that intervention. It's gonna help me have really good teeth, and my health is gonna be improved because of it, and so I deal with it.
Okay, Letitia says, did you offer something for anxiety during the surgery if a person needs it? My nerves will make my forehead sweat in a cold operation room. I had 4 C-sections. So we do have available Xanax, which we use for anxiety. I honestly, I hate that medication. It's not, they call it an anxiety medication, but it makes people lightheaded, nauseous, dizzy, and they don't feel well afterwards. So it causes a lot of complications that I don't prefer to the patients to experience. However, if it's your choice, we have it available, and if you want to do that, you can do that. We'll just obviously discuss the risks.
So part of that, if you want to really get into the technical side of things too, lidocaine can cause problems with neurologic function, and if we are pushing the limits of giving you kind of your max dose of lidocaine, one of the side effects is you can have neurologic problems. Now, we want you to be awake the entire time so we can see how your body is responding and doing, so that we can do this like as efficiently and as healthy as we can. So if you're semi-sedated and you're already at a state where your neurologic function is delayed, maybe your body won't be able to tolerate a significant amount of fat removed.
So Marie says, the quick quote is done via email as a question. So it's not done via email. The quick quote will send you a copy of your selections via email. However, you'll get the quote immediately. And we do have an email option. So if you want us to see pictures to verify the quick quote, you can do that. That's what the email option is for. But if you have lots of questions and concerns, then that's something that you should do with the paid consultation, in which case you get a 15 to 30 minute phone call with us.
Eileen Diaz, listen, if you are, we would have to see your photos. She's asking, can you do your midsection? But her arms are what really bother her. Do them at the same time. We discussed that a little bit earlier. Chances are no. Okay, there have been a couple of very rare occasions where we've been able to do multiple areas. Those are in smaller individuals, but yeah, it's better if we work on one particular area at a time, just so your healing process goes better.
So typically, we break this down into three different quadrants or thirds of the body. So we got the upper body, the midsection, and the lower body, and it's a cumulative problem in that section that we like to take care of. So for example, the arms, if you have larger arms, most cases you're going to have large in the underarm and you're going to have large upper back up here. Most people also have the fullness in the chin. All of these are the problem of the upper body, not just one, but it's all the cumulative thing. Your whole body, everything is connected. So the more that we take care of, the more the illusion of your lean, thin look will come through on every aspect of your body. So when we do the arms, I really like to treat all these other areas that are included in the problem. That's why we don't do it with the abdomen. So with the abdomen, we do everything all the way around the waistline, takes care of the entire problem.
So Nancy Antonio Tejada says, how many people can be on the recovery house with you? So I don't know.
I know the answer to that. I just spoke with Lexi earlier today, and if you have other people staying, you will be paying for the additional space. That they have a limited space there, and she said you don't need anybody to come with you if you stay at the recovery house. They'll have people to take care of you. If you do have someone that wants to come with and you still want to stay at the recovery house, it's going to be cheaper for them to stay somewhere else.
Yeah.
So.
Okay, so this is a cool one. This is where we got really aggressive in her lower back and able to, kind of remove that unsightly area of fat where it accumulated, and now she's just super happy. And look at the butt, and the butt no longer looks cellulitic or have a bunch of cellulite. It looks nice and smooth.
And this was immediate.
Yep.
Immediate. This was still on the table.
Absolutely.
So you see that before picture on whatever side this is to you, the right or the left. That's the before picture, but the after photo is on the table, and you can see that cellulite went away immediately. So, Kale, why does that happen?
So she's got this layer of fat up above, and it's gravity is pushing it down and creating this pressurized area of fat in the buttocks region. And so by relieving that upper pressure from pushing down, it now looks nice and smooth. Now, granted, she's down on the table, but when she stood up, it was the same type of nice and smooth and rounded, more shapely figure.
So I can't tell you how many times I get people, girls, it's always girls, right? And I'm going to stand up to show you what they do. They said, can you get rid of this cellulite? And instead of just showing me, they go, and they get in some weird, crazy ass position. And that weird, crazy position is what it compresses the area causing the cellulite. So that's what happens right here. When the upper portion pushes down on the butt, it compresses and causes the cellulite. So when you relieve the pressure, cellulite goes away.
Elise says, some of the areas were painful. In some areas I was laughing. Yeah, so she was funny. She really was. We would hit certain areas and she would start giggling. It was kind of fun. And I would use that area as I was working on her to kind of get her refocused and get her calmed down. It was awesome.
Light Bright. You ask, will you guys be doing fat transfer to the breast in the near future? Not only will we be doing it in the near future, but we've been doing it in the long past as well. We've been doing fat transfer to the breast for 7-8 years now.
Yeah, we're also doing it in the current too.
Right.
Not currently right now, but.
So yeah, go on the quick quote there. The option is there. Fat transfer to the breast or the butt. The price is the same for either the breast or the butt for the addition of the fat transfer.
Mm-hmm.
Okay, Tara Murray. She said, have prices gone up? I noticed that the prices were no longer on the website. So it's a new pricing structure. We're no longer doing the per area structure. The pricing is based off of a BMI, which is categorizing individuals in different price structures. So go through the quick quote. You can get your price right there. It's quick and easy. You don't even need a consultation. But if you like the quote and you're serious and you're ready to move forward, the next step is then a formal consultation where we need to speak with you.
Absolutely.
All right, man, we got caught up on all these questions.
Yeah, we're 45 minutes into it and going pretty good so
Awesome.
far. A lot of good photos that Granville's putting up. We'd like to send a shout out to him for making sure that we get the appropriate visuals to illustrate what we're talking about.
So I like this picture here. This is kind of cool because it's a progressive picture, and it shows not only where she started and where she stopped, or where the after is on the bottom corner, but it also shows the in-between, and the in-between is clearly she's not as small as she was after in the after photo, but the in-between is reflective of the swelling that she experienced, and you can see how significant that swelling is. So when we take the fat out, the fat's gone. However, your body fills that space with fluid, and that's the swelling, which means that after the procedure, you could theoretically look the same as you did before, if not even bigger. Some people swell up. So the recovery process is real, and it does take time for that swelling to go away. And some of these larger individuals, it may take months for all that hard swelling to go away.
Yeah, and just because it gets, like hard after the procedure, it's normal. It's absolutely normal, okay? And it can wax and wane, meaning it can come and go. Yeah, on the larger body habituses, we found that the inflammatory process, actually takes a little bit longer than somebody that's a little smaller.
Nat Hernandez, can't wait to get yours done. That's awesome. That name sounds really familiar.
Here we go with Tricky
Sure.
Mickey coming at
Tricky
you.
Mickey.
Yeah, so listen, Tricky Mickey is a truck driver, and she's part of the group and got a ton of energy. And she came in, we did the front of her abdomen. You can see her progression pics too. So this is before, this is probably immediately after we treated her, maybe a day or two. And then as you can see, it's getting better, and the inflammation's going down, and you can see the real results.
Linda Angel, do you add fat transfer to the private parts, and if so, how much time does the fat transfer last in those areas? So
you're talking about a labioplasty, where you're like fat transferring to the vaginal
maybe
lips.
that's possible.
It's possible. You can do
It's not common. It's possible.
Mm.
I mean, technically, you can transfer fat to any part of the body. That's theoretically possible. The question is, where do you want this additional volume? And then the recommendations for fat transfer is to put no pressure on the area for 2 weeks and limited pressure for 2 months. So where we transfer the fat, ideally, you should be able to keep pressure off that area for, 2 weeks to 2 months. Do you offer any skin tightening along with lipo? Absolutely, Monica. And if you go through our quick quote system, there's many of the procedures already include smart lipo, which is laser skin tightening, on the most common areas. So for example, if you're treating the abdomen, it's included in the package. We're gonna treat the front of the abdomen with smart lipo. When you treat the arms, it's already included. When you treat chin, it's already included. Now, if say you're an individual who has very loose skin all throughout your body, and you want smart lipo for the skin tightening in all the areas that we treat, then it's just an additional fee for that.
There you go. Befores and afters.
Amazing results. I'm sure that this her belief system when she's in this particular state, the before is very insecure, trying to hide herself in pictures, maybe wearing some big baggy clothes, probably shying away from those date nights with your loved one, maybe even avoiding intimacy. We've had a lot of patients that talk to us about the intimate level, and how just because they felt like they were ugly, or they put on this extra weight, it ruined their intimacy with their partner, and that can, cause relationship problems over time. So,
How many of you have this issue with this belly button? See, when you gain weight and you get fuller, that belly button starts to look weird, right?
it's like a frowny face.
Yeah, you get like this sad face. So you can see in the after photo here, their belly button's totally different. And if you pay attention to some of the other pictures that we do, it's very different. The belly button changes, and it's simply a function of the volume of fat and how its gravity's pulling down on it. So everything changes when you remove the fat because of gravity. It's a laws of physics. Yes, labia transfer. It's
So it's possible. Yeah, listen, we do a lot of fat transfers. I mean, it would be pretty easy to do, I think.
When I did my my fat transfer training years and years ago, the doctor, as an example to show us that fat can be transferred anywhere, he transferred fat to the lady's ear, and she had like a little ripple in her ear, and so he transferred fat to the ear. Bizarre, right? But the point is you can transfer it anywhere. So
So question is, how long do you have to wait in between procedures? So that just depends on the area that we're working. If we work on the front of your abdomen and the next procedure you want to come in and get your arms and bra rolls, that can be a very short time frame, about a month. I like, if we're working on the front of your abdomen, the first time to the transition to the love handle, hips and lower back, I like a couple of months. That way it allows the inflammatory process to kind of level out, and people tend to do a little bit better. Trevor's a little more aggressive. He likes 1 month with that as well. So, I mean, it just depends on how your body is responding.
Well, I think what Kayla's talking about is the in-between, like, so if we treat the front of the abdomen and then we're gonna come around and finish out the waist, there's gonna be that in-between where the two sections, like, they're covering each other. So on the second procedure, we have to come and overlap. And when we overlap some of that scar tissue, and after a month, it's really tough to get in there. So what are you concerned that we might get less out?
No, I'm just like on these larger individuals where we have to divide them up, it just gives the body time to just recuperate fully.
Yeah.
And that inflammatory process goes down a little bit after that second month.
So Nancy says, if you have diabetes, is it long to heal? Well, in general, diabetics heal slower.
Mm-hmm.
They have vascular issues, which may lead to a decreased healing time. May also lead to wound issues. You might have a higher propensity for infections. It's as a diabetic, it's kind of like all bets are off, and things are just going to take longer, and we just don't know what to expect. So we do everything that we can to keep you as healthy as possible. But as a diabetic, it is what it is. We just try and deal with it. However, it is possible to do the procedure with diabetic, and it is possible to have a great recovery as a diabetic as well.
And it's even possible to improve your diabetic state.
Yep.
And with the help of your primary care provider, you might be able to get off your meds, right? That was always a concern for me when I got into medicine. And even before then, I would see all of these people that had these lists of medications, and I thought to myself, man, that's got to be expensive. And then after getting into medicine and noticing how much each one of these medications costs, man, holy smokes, if you extrapolate that over 20, 30, 40 years, man, you're saving a lot of money.
Yeah.
And you're just basically, you're taking that money and you're investing it into your body, and you're just going to live a better life.
Better life, longer life, higher quality, more active, less limitations. See, how much is lipo in the arms? Erica, that's a fantastic question. And you can easily get that quote. You're gonna simply go to our website, myshapelipo.com, hit the quick quote, and you get the quote as you're speaking right now. You can go on there right as I'm speaking. So please go do that. Okay, I need thighs, stomach, and breast lift, and arms. So that sounds like full body.
How can you even ask that over like this public forum? We have no idea what you look like. I mean, listen, jump on the website, get your information sent in,
Right.
Schedule a consultation, and let's get you taken care of. Let's get you right for summertime. All right?
Surely, that's full body liposuction. It's not safe to do full body liposuction. I mean, if you go to Mexico or Colombia, they'll definitely take your money, and they'll definitely do a bunch of crap on you.
And you may or may
And
not
even-
make out of the country alive.
Exactly. So, our safety is our main goal here. This is a cosmetic procedure. It's an elective procedure, which means that you don't have to have it, you want it. So we're not putting anybody at risk where you're going to die. I don't need that on my hands. Kale doesn't need it on his hands, and we certainly don't want your family to be upset.
That's right, because ultimately it comes down to we're trying to improve your quality of life and help you live your best life. We don't want to cause any complications. It's going to cause mortality.
Right. Okay. Adriani says, where are you located? We are in...
Yo no me acuerdo. Yadari, ¿me puede dar un aproximamiento por la tupi solo estómago? Bueno, depende de su tamaño en cuanto a su estómago. Cada estómago y cada cuerpo es diferente. Por favor, use nuestra página donde se puede recibir un presupuesto rápido según su categoría de cuerpo, y eso le va a informar cómo cuesta mayormente, okay?
So Shirley says, can I send you pictures for pricing? Absolutely. It sounds like you might have a more complex situation. So that's what our paid consultation is for. And you can send us pictures, and myself or Kale will evaluate the pictures, evaluate your situation, as well as your whole medical situation as well, to come up with a good plan and get you some accurate pricing.
Listen, I'm going to be completely candid with everybody. There are times where Trevor will look at me and says, "Hey, dude, let's do this one. Look at this." And I'll be like, no, I don't know. I don't feel comfortable doing that. And then there are times where I say, "Hey, let's do this," and he says, "I don't feel comfortable with that." So your health is paramount. Okay, so we do not just like look at the photos and throw you aside if you don't fit this particular body type. We look at everybody's body type, and we are making sure that you're the appropriate candidate. That this is going to be something that's going to benefit you, and we feel like it in most cases it does. So we're very aggressive and we're very liberal on choosing candidates.
And you are our walking billboard, literally. So you're walking around, and when people says, "Hey, you look amazing," we want you to say, "I went to MyShape Lipo." When your family's like, "Oh my God, I can't believe you've never looked like this in your whole life," or "I can't believe I haven't seen you smile like this forever. What happened?" We want you to say, "I went to MyShape Lipo," and explain to them why you got the results that you got and how you got the results. So you're our walking billboard, and it's in our best interest that you get the best possible results and have the best possible experience.
So Elisa says her blood pressure is 130/80. Can she get lipo? She's only 23 years old. So listen, this is an educational moment. So bottom line is, blood pressure will go up and down according to what the needs are of your body. So when the Tyrannosaurus Rex comes in and growls at you and attacks you, or wants to attack you, your blood pressure is going to go up, your heart rate's going to go up, your body's going to respond because it needs fuel to get away from it. So your blood pressure is going to go up. When you're sleeping, it goes down. So normally it goes up and down, up and down. So just because it's 130/80, which is still normal,
On one reading.
yeah, and one rating does not mean that you have hypertension or high blood pressure. Okay.
What are the standards for diagnosing high blood pressure?
So 140/90 systolic on multiple occasions. That's what
It's got to be multiple, though, right?
It's got to be multiple occasions. Yep.
So they call it white coat syndrome. When patients come to the doctor, when they see the white coat, your blood pressure goes up.
Mm-hmm.
So that's why in most cases you need it to be multiple. So I kind of guapissimo. I mean,
she's
you're looking,
saying,
right?
yeah.
Yeah,
Those
she's
pictures are
right.
very good, yeah. And this guy's Spanish is getting better.
Yeah.
I like that.
If a person has anemia, can they still get lipo?
So yeah, anemia is one of those things that happens to a lot of people. It's just basically a lack of a particular blood product. Typically it's the red blood cells. And most oftentimes it's caused by an iron deficiency or some sort of malabsorption deficiency. So it doesn't exclude you. We want to make sure that you have the appropriate level of blood before you get a procedure. So oftentimes we'll start you on some iron supplementation, recheck that blood level, make sure that it gets up to a certain level. That way, whenever you're when we're doing the procedure, your body has enough red blood cells to carry oxygen and nutrients to all parts of your body so that you can heal appropriately.
Wendy says, ¿Cuánto cuesta la cita?
Bueno, para fijar una cita con nosotros, en esta cita vamos a hablar de sus metas y también lo que quieres y también el precio y los riesgos y todo. Eso cuesta $100 para hacerlo. Es para las personas que están bien listas, tienen mucho ánimo a fijar una cita para cirugía.
Suji Arce says, how long is the recovery for the stomach? The recovery is going to be a little bit different for everybody. As we were saying previously, diabetics are slower healers, so it might take a little bit longer for them. Larger patients, when we do larger volume liposuction, they tend to have more swelling, more bruising, more drainage of fluid, and it takes longer for that stuff to go away. However, some individuals heal very quickly and can get back to life very quickly. Our statistics show that about 87% of people claim that they were able to go back to work after 3 days, and typically that's a sedentary type job. But it can be quick, it can be slow. You should be prepared for both, and just be conscious and aware of what's possible.
So Claudia asks, are there risks in getting blood clots after the procedure? Yes, there are, and here's why. Because once we take out a significant amount of fat and we sculpt your body, you're going to have this propensity to go home and say, "Ow, my abdomen or this area hurts." And so
We've had people just lay in bed for days on end. Well, if you're stationary for a long time, that's when blood kind of just pulls down in the lower extremities, and it has this propensity to clot up, and that's what causes DVTs or blood clots. So after the procedure, we want you to go home, we want you to rest. After you rest, every couple of hours, get up, walk around, get that blood flowing. Make sure that you get that blood out of the lower extremities by walking, and that's by the calf muscles contracting and releasing. They act as pumps. But yeah, if you fly back on a plane, the same idea. Even if you haven't had a surgery, when you're on a plane, it's good about every 3 hours or so, 3 to 4 hours, to get up and just kind of walk around and make sure that your blood is kind of circulating throughout and not forming clots.
Kamini, she's challenging us. She said, "I bet you will have a challenge with me." I
Why don't
dare
you show
you.
up?
I dare you.
Yeah. Come on.
I accept challenge.
Uh-huh.
Yeah, we beat the hell out of fat. Leave no fat behind. That's my mission. It's kind of like military. That's my military thing, Even though I'm not military, but leave no fat behind. It sounds good. It's a good motto. Nat says exactly what I say. Every compliment I get. It's amazing. When you feel better about yourself. Okay. Estudio. Love that you guys are looking out for what is best for the patients. That says a lot about you.
Well, thank you. Appreciate it, right? So it's important to make sure that we put you on the right track and you don't end up in the hospital, right?
What's good for you is good for us.
Mm-hmm,
I mean, I don't know how it could be any other way, really.
Yep.
So
that's why you're coming in, because you're trusting us with your medical care. You're trusting that we can help improve whatever body habitus you have and where your body's at. So yeah, thank you for that comment.
Elizabeth Maita says, "I've been trying to ask if you guys are the doctors that do the procedures." So we are the ones that do the procedures. We're both PAs, physician assistant. I've personally been doing this for 15 years. I own MyShape Lipo. I've done over 15,000 liposuction procedures. I train doctors. I've trained over 150 of them over the years. So this is one of those things that people believe that a title, a piece of paper, makes you good at anything, and it's total bullshit. But you can believe what you want. If you believe that you need to go to a plastic surgeon or someone that went to Harvard, then that's what you should go find. And I don't even want to argue with you about that. So we have the experience, and not only that, we have the proof that we've done amazing stuff.
She's just asking.
No, I'm explaining because some people don't understand.
Right. And I've been doing it for about 5 years, and I also have a bunch of emergency medicine background, and so there is. Oh, thanks. Appreciate that, Elise. So there's very few disease states that I haven't been exposed to. There's very few critical cases that I haven't been exposed to. In fact, we had a lady that kind of staffs a big medical practice, and her comment was, "Oh man, I feel so much better knowing that Kel has emergency medicine training. That way, if something were to happen, he could take care of me." So yeah, I mean, between the two of us, we got plenty of experience on the cannulas as well as the medical side of things. So you're in good hands.
LC says, "Kale, you're doing a great job with the Spanish. That's awesome."
Bueno, gracias.
Kamini says, "Have you guys worked on someone who's had a botched tummy tuck and breast reductions?" Lots of them. Lots and lots of them. And I'll tell you, this is what started me on this whole this kick and telling people you don't need a tummy tuck, because there's so many people that get tummy tucks and then they need to get liposuction. And then we get these results where the tummy tightens up after liposuction only. No tummy tuck required. So I'm hoping to save people before they get the tummy tuck. That's ideal. However, if you got the tummy tuck already, then you already know that they didn't get enough fat out, and you still have, you lack the curves, the natural curves that you'll see, the shape that we're able to create with liposuction. You lack that. So it's definitely something that we do. We fix, botched tummy tucks all the time. All the time. In fact, I was just telling a story earlier yesterday. I had a person from Chicago, 26-year-old or something like that, got a tummy tuck and liposuction 360 and a fat transfer to the butt, and the results were horrendous. She was left square shaped, and so we're gonna help her. We're gonna make a big difference for her.
Listen, not to identify any particular location that does that, because there's clinicians that do this type of bait and switch, or just maybe they're not very proficient in their skill set. But New York, we've had quite a few patients from New York that allegedly have gone in and gotten abdominal 360s, and the results were like
did they do anything?
Right.
And then Chicago was
Mhm.
another most recent one. We've had 2 or 3 of those, and then Florida. So
Florida,
I mean,
yeah.
so
So
I don't know.
those are I think some of the more common areas where people get procedures. And there's people that come out of LA as well. People, when you go to get these procedures, there's a lot of different places, particularly on the East Coast, New York. Just because you live in New York, just because there's doctors there, doesn't mean they're good at liposuction.
And if you want something that's amazing, if you want quantifiable results, then here's the pictures, right? So this is a nice little fat transfer after liposuction from the midsection, upside down heart. Give this lady a nice little rounded version of her butt, and she loves it, and she loves sending me pictures. So I love it whenever they do that.
Julie says, I had a penectomy about 6 years ago. Would I be able to get lipo in the midsection? That's the same as a tummy tuck. They're just cutting away the skin. I wish we could have saved you before you got that done, because it's not really necessary. However, yes, since you've already had that done, we can take out all the rest of the fat.
So Charlie 4450, if you had lipo and now have scar tissue, can you assist with that? So what happens, Charlie, a lot of times is people will get liposuction and then life will happen or whatever. They'll not be as healthy as they were or whatever for a time frame, and they'll gain weight in that area, and so it kind of distorts the results. Yeah, so that's called a revision. We do a lot of those, actually. Yeah. In fact, we should probably start promoting that, because if you're going to the breast guy, what somebody told me early on in my career was, if you want to go to the best breast augmentation person or provider, you go to the one that fixes everybody else's stuff.
Mm-hmm.
And since we do a lot of revisions, here's one right on cue. Thanks, Granville. You can see. So she had it done like 15 years prior in Colombia. This is a Colombiana. And she came to me, she was like 52, and she said, hey, what can you do? Do you think you can do it? And I said, I can do whatever your body allows me to do. And so came out real nice and very sculpted, and she's super happy.
So whenever there is scar tissue, the scar tissue does pose an issue. So whenever you had previous procedures, there's going to be some scar tissue. And the thing is that that's the wild card. We don't really know what to expect. And it can be really easy, and it can be really difficult. And the truth is we don't really know until we get in there. So if it's worth it to you to try and get these things fixed, then you gotta go through a little bit of risk in realizing that we may not be able to do this on everybody. However, it's in many cases we are able to.
Listen, I can promise you this: in this entire country, there are not 2 more capable and willing and just stubborn persons when it comes to improving revisions when you're on our table. Okay. So a lot of the reason that plastics and cosmetics guys don't like to do liposuction is because it's such hard work. When you get into revisions and fixing other people's stuff, it's even harder. But I'm telling you, you'll see the sweat dripping down off our brows. Yep, that's another picture of her. It's just like we work, and if it'll come out, I guarantee we will be the ones to get it out. So come see us.
Beba says, mi meta es cuidar bien mamacita.
So her goal is to leave her like a very good-looking
Mamacita.
Yep.
Okay.
Hot mama.
Hot mama. Okay, very much so. I look like SpongeBob. So, if you didn't get that term from me, I use it all the time because we turn SpongeBob into hourglass figures, and it's definitely possible. Definitely possible. I'd say that's my specialty. Is converting SpongeBob into a hourglass figure. Elizabeth said, I'm making my phone call tomorrow. What are your hours of operation? 9 to 5, Monday through Friday.
So Elizabeth, before you make the phone call, jump on the website, okay? Jump and use our quick quote modality, and then you can kind of get an idea. And then when you talk to the girls on the phone to kind of set up a formal consultation, then it'll be a lot easier. You'll already be exposed to the things that we're looking for, and there's a lot of information on that page, so a lot of your questions will be answered.
And if you're looking to the consultation, if you're serious and you're ready to move forward and you want that formal consultation, you don't have to call the office. You can do that from the website as well.
Yeah.
And again, many of the, I added the frequently asked questions to the quick quote, so it gives you the opportunity to go through a lot of these questions that are being asked here in the live. They are in writing as well as in video format on the quick quote.
So I don't know if we answered your question though. The hours of operation are, I think the girls are going to be in the office
9 to 5 or 9 to 4:30.
Yeah,
West Coast time.
West Coast time.
Julie says, I do have a lot of scar tissue. I've also had my gallbladder removed and C-section and penectomy.
Okay. Listen, you're one of those, individuals that's had some issues with your body. No big deal. Submit your photos. Tell us what your goals are, and let's take a look at you. And listen, there are very few people that we actually turn down. Okay. So if we feel like we can intervene in a positive manner and give you some amazing results, we'll let you know. If we feel like it's not something we could do, then we'll let you know as well.
I've done a lot of revisions, and I say these very pessimistic words when I talk about revisions, because I have had situations when it was extremely difficult and I was unable to do what I wanted to do. And that's happened probably 2 or 3 times in hundreds and hundreds of revisions. So it's not that common. However, if you're that person, I have to tell everybody, because you might be that person that is really difficult for. But revisions, in most cases, we're able to make a very, very nice improvement.
So Angie Estrada dice, ¿cuál es la website? Tiene que ir a myshapelipo.com, myshapelipo.com, y allí puede encontrar la información.
Van al orden que se hizo la pregunta.
So, bueno, más o menos estamos tratando a mantenernos con los preguntas que vienen por la Facebook y también Instagram.
So what did she ask for?
So she's, are you going in order that the questions are answered or asked?
Yeah. ¿Cuánto cuesta un lipo?
Bueno, eso depende de su cuerpo, pero si quieres saber el precio por su cuerpo, hay una manera bien fácil. Tiene que ir a nuestra página de web.
Julie says, do you have financing available? There is a finance company that we deal with. The information should be on the website. We also have a kind of like a layaway type program where you can make monthly payments, and once you're paid in full, then you can move forward. What is the highest BMI you work with? That's an interesting question, Mary. There are individuals, like I just quoted someone that had like a 55 BMI. However, it's more so, it's like how it's these larger individuals, and the reason why we need to speak with them is because the higher BMIs it's a measure of the volume that you carry. However, individuals carry it differently. Some carry it more in the upper body, some carry it more in the lower body, and some carry it in that midsection. So if you carry everything in the midsection, it may limit us significantly. If you're spread out differently, we might be able to we might be able to treat that midsection, or maybe we have to break it down into even smaller chunks where we can maximize the amount of fat that we get out of one area. So there's a lot of variables, and I have a lot of ideas on how to solve these problems for larger patients, but we just got to figure out for you. So go through our process, and it sounds like you would be beneficial of going through the formal consultation process. You're welcome, Julie. Do our best. Looks like we're about done, right?
Yeah, we're done. Done for
I'm
the day.
tired. Thank you guys. We appreciate you so much for coming by here today. When you're ready, get your, first of all, whether you're ready or not, go get your quick quote, just so you know. You might find that you can get something way sooner than you think. You might find that it's not as expensive as you thought it was going to be. And your life transformation is right around the corner. You got to start taking steps in the right direction. When you start taking those steps, all of a sudden you start knocking down your goals. So create these longer term goals, and let's start making it happen for you. We're here to transform your life and help you walk across that path and find what these other individuals are finding at the end of the rainbow here. So when you're ready, get that quick quote, and if you're serious, let's get that formal consultation to get you started. You want to say something in Spanish?
Bueno, es importante que empiece a vivir su mejor vida este día y adelante. Bueno, llámanos y visita nuestra página de web para que podamos empezar todo el proceso. Okay?
All right. Thanks, guys. We'll see you next time.